Hello, this is Dr. Gabe from First Look MRI, and this is a 25-year-old male who felt a pop in his knee about 2 weeks ago and finally came in for an MRI scan to see why his knee is continuing to hurt. And it looks like he has a tear in the back where he felt the pop. So this is a tendon surrounded by edema and hemorrhage, and it comes down here posteriorly and medially, and it ends right there. Now we have fluid, and there's the torn tendon end. We can see the same thing back here. It's coming down the posterior aspect, comes over here and ends right there. So the question is, which tendon is this? So if we go up above the knee joint on these axial images, we're going to look for the hamstring tendons. There's 1, 2, 3 hamstring tendons, the back tendons here, and we see that the middle one looks like it's the culprit. So if we go up 1, 2, 3 muscles, this is the biceps along the lateral side. We have the semimembranosus and semitendinosus. And we can make sure this is the semimembranosus by following it down. Semimembranosus is a big muscle. The semitendinosus will be a tendon, while the semimembranosus is still a muscle. We're going to come down, down, down. Here's the semimembranosus tendon finally, and it attaches here in the posterior medial tibia. So we see the semimembranosus is intact. This is not the semimembranosus. This is the semitendinosus. The biceps is over here. That's going to come down laterally and attach over here in the fibular head. And so this is the middle one. This is the semitendinosus. Now we're going to see the semitendinosus, the muscle, turns into a tendon pretty high. And we're going to follow the tendon down. And indeed, it's completely torn, ruptured. And we see this fluid or hemorrhage. And this is one of the 3 pes anserine tendons. So the pes anserine tendon complex comes down here and attaches on the posterior medial aspect of the tibia. And so we see fluid there. Now the other 2 pes anserine tendons, let's see, we have the sartorius here and the gracilis. So we have the sartorius, gracilis, semitendinosus. These other 2 look like they are intact. It's just the semitendinosus that's torn. So we have an isolated tear of the semitendinosus from its attachment here in the posterior medial knee. I believe this is the first one I've seen an isolated tear like this. And that's it. Thank you very much.